The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Casino. There's no place like Hollywood. And by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Hello and welcome to Mature Lifestyles, brought to you by Spectrum Generations. Our goal here is to live, laugh, and learn, and believe me, you're going to learn a lot today. We have extraordinary guests, and what could be more fascinating and challenging to us in taking charge of our own health care? Question that? All right, you've got some people who are going to help us understand it. First, I'd like to welcome Kellie Slate, and I hope I pronounce it correct. I should have asked you, you say it.
Vitcavage.
Vitcavage.
It's a mouthful.
It's a mouthful, but it's a beautiful name.
Thank you.
Vitcavage. And your first name is Kellie, easy enough. And then you are with Quality Counts, and you're going to tell us about that. And then we have a doctor, Dr. John Barnes. Are you related to another Dr. John Barnes? Is the Barnes family name in medicine in this area?
No,
you just are
to John Barnard.
Okay, but you are a family physician, beloved in the Winthrop Family Practice, and doing both medicine as well as administration, and you're talking about how that's important. But we've got to help our consumers now, including me as a consumer and you yourselves, to choose wisely. First of all, tell me, Kellie, a little bit about you. How did you get into healthcare? What's your background?
Well, my background a little while ago was in health education because I felt very strongly that if we could help people prevent some of the chronic diseases that we're faced with today, that it could help lessen the burden on the healthcare system and as patients and consumers. Okay. So I have a large background in health education.
So you like teaching about this subject?
I do. I like to bring the information to people to help them make better decisions and smarter decisions.
All right. And so you're with Quality Counts, and maybe you could tell us what that is.
Sure. Maine Quality Counts is a nonprofit organization that works to help providers, such as in Dr. Barnes' office, provide healthcare better, more efficiently, have better skills in order to do that. And so we have skilled professionals that are healthcare professionals working with various family practices around the state. And we also work with other groups such as the Area Agencies on Aging and other consumer groups to help bring information out so that we can all be better in the way that we choose healthcare.
You're really a great resource.
We are.
For groups who are helping patients as well as providers. And so I'm going to turn to my provider. Tell me a little bit about you. You're in medicine. How did you choose your career, and how did you choose the Winthrop Family Practice?
Long road to get there. I started out as an orderly and subsequently as a nurse.
Yes.
And what I liked best was actually putting hands on people, helping them make them feel better.
Great.
Path to medicine, then got to medical school, the usual, and trained in Maine Dartmouth Family Medicine residency in Augusta, and decided to stay in the area, convinced by my wife.
We're grateful for that.
I went out to Winthrop because there was a physician at the time there who was just an incredible mentor, and I was looking for that kind of guidance and leadership, someone who just loved taking care of people and was loved in the community. And practiced clinical medicine for about 15 years, but I also have a knack or an interest in systems and how they work effectively.
Okay.
And as the practice grew, it was clear that it needed someone with that level of interest to help sort of maintain what we're really there for, helping people.
So with your love of medicine and helping people, but you also see the system as making a difference, and so therefore working with Quality Counts is important to you. How does it help your practice?
The risk now is that we get so locked into what we're doing because of the pressures of payment and documentation and liability that we lose touch for what people really want.
Okay.
And we think we know that. But if you look at some of the information on the Consumer Reports Choosing Wisely website, surveying physicians and surveying patients come out with radically different answers about what they want.
Give me an example If you can think of one, and maybe you can help him, Kellie, something that consumers might say they want and what physicians hear or what they think.
Yeah.
Where do they diverge?
One of the ones in there, if you have them at your fingertips.
Both of you can.
Well,
yeah.
one that comes to me, and I don't know if we want to jump into that right off the bat, is
It's okay. Go.
What's the percentage of time that your provider, if you're asking me as a patient,
Okay.
talk about the cost of a certain test or procedure. So there's a big disconnect for that, but there's also a disconnect in the way that how I experience the care at a certain practice, which may be very different from what the provider side are saying. Hey, we have this is how we work with our patients, this is how we feel it should best be run. And then the patient comes in, and we have patient family leadership teams who actually say, no, this is how we see it. It's because we're coming from two different perspectives.
Is this a new, you talked about systems change, is this new that doctors, at least at this point, or providers are trying to figure out what it is that customers or consumers want in a different way?
Maybe the last 5 or 10
years. It's an
really
evolving.
And our practice familiarity with quality count started with the patient-centered medical home pilot.
Okay, now tell us what that is. Patient-centered medical home. It sounds wonderful.
It is.
But what does it mean? It means probably what it says.
Yes. Yeah. Unfortunately, because providers are so pressed for time, they become the center.
Okay.
Everything works around them. You come
as
when it's
opposed to
them,
being around the patient.
Which is, you used to be. If you go back far enough, we'd go to your home and see you. And so it was to try to put the emphasis back on seeing the patient. In order to do that, with the complexity nowadays, you need a whole team of people. You can't just do it with a provider. So you have wrap around the patient. One of the best examples of sort of the beginning of that was at the Mayo Clinic, where the patient comes into one room and all the providers there to see that day come to that room.
Oh, so the patient doesn't chase people around, but everybody, if a person has complex conditions that touch more than one area, those providers come to the patient.
In the outpatient setting, the similarity would be you still come to our office, but we're also exploring ways to get beyond that, but different conversation.
All right.
But the person who checks you in, the person who puts you in a room and takes your blood pressure, the person who sees you when you check out, all are a vital part of the team that's helping take care of you. And they recognize that, they value that, and you see that as a patient. And the physician visit or the nurse practitioner visit, physician assistant visit is a part of that whole thing. And there's people in the background who are supporting that team who you see, and it's cohesive, and you feel like it's wrapped around you.
Okay, well that sounds like the way it should be, the way it used to be before things got so complicated. But as medicine has evolved with more complexities, I'm sure that the system has pushed you away, and now you're trying to come back to that original concept. But I'm intrigued by one of your, I don't know that I've ever had a doctor tell me how much a procedure costs. And you're saying that knowledge of cost is important in that conversation because it helps you choose wisely. Can you give me an example of that?
I think that Dr. Barnes probably could give more of a real example of that, but it's part of the 5 questions that we're trying to portray and put forth in the Choosing Wisely.
Why don't you tell me your 5 questions, and then I'll come back to you to see how the provider responds. Or I start with one of them anyway. We probably won't have time for all before the break.
It's like the 5 questions. Do I really need this test or procedure?
Do I really need this test or procedure? So if you go for your just regular checkup and you suggest that someone have what kind of test, for example?
Mammogram.
A mammogram. And so my job, I have a responsibility as a consumer. Do I really need that? And how do you answer? How do you know how to answer such a question? Is it based on certain parameters that you've?
One of the best ways I know is national guidelines put forth by professional organizations that I trust.
Okay.
So they might say, for sure, after age 50, you need a mammogram every 1 to 2 years. Another professional organization might say after age 40 every year. So they don't always agree.
Right. So you have to sort through the best evidence that you can.
I do.
And knowing your patient as well.
Knowing my patient. And then even then, what I'm saying to you really, if I had the time to spell it out, is statistics show that the risk of having this procedure is vastly outweighed by the benefits of having this procedure.
Okay.
But there are risks. And the benefits may not be a sure thing for you. So you'll probably benefit, small risk. That's a long conversation.
It is a long conversation.
What should I do, doctor? I said, get a mammogram. There,
right.
We're done.
That's what the people.
We're all done.
Exactly. Well, it's like the things that come with your prescription medications can cause, and they list so many horrible things. I'm surprised anybody ever takes an aspirin.
Right.
So, but that conversation needs to occur with the doctor. What are the risks and the benefits to me as the patient?
And almost as if you know the questions to ask, you might have no doubts about mammogram. Yeah, you know that already. You're going to do it because I recommended it.
Right.
But then when I say, probably you want to get a Zostavax or you want to get
and
a
I
shingles
wouldn't know
vaccine.
anything about that.
Vaccine
Right.
against shingles.
Exactly.
Now you can say, okay, wait, let's go to the 5 questions because I don't know so much about this one. So you would be the judge. What am I going to?
How do you deal, given the fact that the consumer has to have a little bit of knowledge to have a good conversation with you? There's so much television advertising. I think of shingles and the terrible fears and the advertisements they show about how horrible it is. And I might come to you and say, I really need a shingles vaccine. Well, how would you talk to me? My only knowledge is from television. Depends on the patient, I'm sure.
Yeah, but what I would try to line it up with is, here's what research has shown is the benefit.
Okay.
And how likely that is to help you.
Okay.
And here's what experience and research shows is the downside of the risk.
All right.
And you weigh that, and if I know you well enough, I'll know whether you're the sort of person that really wants the protection, doesn't care about the risk, or really worried about the risk and not so sure they need the protection.
All right.
We'll try to lay it out for you and then help you decide.
So you're an educator too.
Right.
So you're very
Yes,
similar
very
in
much
terms
so.
of educating people.
At a very high level.
All right.
So he's actually gone through a couple of the other questions. What are my risks?
Oh, well, all right. What
are there simpler, safer options? What happens if I don't do anything?
Okay.
And then the last one is how much does it cost? Because we know in this day and age with out-of-pocket.
Okay, so you need risk and complications.
Simpler, safer
Simpler,
options.
safer. Are there other options?
Right.
Or if I do nothing.
Or if you do nothing,
Yes.
what would happen?
Those are the-
But it really is, for you as well as the patient, a risk-benefit analysis always, because nothing is certain, is it?
Right. No, nothing is certain.
But
But at least gives you an opportunity to have something to start the conversation. Many of our patients, and what we want to do through the Choosing Wisely campaign is help empower, engage, and educate consumers. And the 2 national partners we're working with, Consumer Reports, who puts all of this in consumer language that's easy to read, and also working with the American Board of Internal Medicine Foundation, which is great to have the evidence-based information for our physicians.
so in terms of outreach, there's if I want to educate myself, as which seems like anybody should, Consumer Reports, you say, is a good place to go.
Yes, it is. And they provide these very easy to read 2-page information sheets on a multitude of opportunity for tests, procedures, to make it simpler and easy to understand for us.
And so the title of theirs is Choosing Wisely, which is what we're trying to talk about today.
Correct. Yes.
It truly is a shift, isn't it, in terms of empowering a consumer,
Yes.
that they're part of the choice.
Absolutely.
And I think that might be, is it more difficult with seniors like me, because for so long it was the doctor said, and this is what I do. So is it an education process for seniors, and not just seniors? I mean, we all like to think that you're the authority figure because you're so smart, you're well educated with medicine, and what do I know about lower back pain?
Exactly.
Except it hurts.
Absolutely. Definitely.
The funny thing is that they've spent a whole lot of their lives believing that they're supposed to do whatever the doctor says.
Exactly.
But then the fact is, when they leave the office and go home, they may not, because they don't really believe in it. And there's some research that showed that a huge number of people don't take the prescriptions we write for them because they're not convinced they really need it, they're not convinced it's safe, or they can't afford it.
They can't afford it, and sometimes when they can't afford it, if you have those other things going on in your head, that it doesn't really matter if I miss this dose. All right, well, stay tuned. Come back for more of Choosing Wisely. See you in just a moment.
This is the new Hollywood Casino, featuring the heart-pounding action of live table games with Vegas-style blackjack, roulette, poker, and more. Now playing at the place where the fun never stops. From the thrill seekers to the blockbuster winners, here you've got the lead role, because there's no place like Hollywood.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both. At Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
Welcome back to Mature Lifestyles. Spectrum Generations is bringing this extraordinary discussion between 2 talented people in the healthcare world. We have Kellie and John, and we're talking about becoming a partner, a wise consumer, having conversations with your doctor, and a primary care doc is just the leading edge of what's happening and the changes. Actually, it's back to the future almost, in that I hate to tell you how old I am, but I bet a lot of our viewers know this. When I was a young child, the doctors actually came to my house. We're not advocating that you do that, but we're saying you need to ask the right questions. And there, you talked about a consumer reports, and there's an article here you brought me about treating sinusitis, imaging tests for lower back pain. So hopefully, if I've read articles like this, if these are my issues, when I come into your office, we can have a better conversation because I know a little bit. And so if I came in looking for an imaging test, my back really hurts. Dr. Barnes, do I need an x-ray or an MRI or all those big words we throw around? How do you decide?
The Choosing Wisely campaign has really attacked this in 2 different ways, sort of in parallel. One is this sheet you're looking at that tells you what to think about, whether or not you need a test, whether it's really likely to help you. And the other is guidelines for providers about, from say the American Academy of Family Medicine or American Academy of Pediatrics, about here's 5 things that you should consider doing or not doing that are good medicine. Don't just do it because it's good medicine to do it.
Okay.
So in your case, we'd look at that together, or you would have looked at it before you came in. It's on the internet. You go to Choosing Wisely site, you've read it, you come in and say...
There is a site on the internet, Choosing Wisely. And that's what the Consumer Report site is called? Or is that a separate site?
It's separate. It's called consumerhealthchoices.org.
Okay.
Or they could just go to Maine Quality Count /Choosing Wisely.
Okay, so we
Gets
can,
them
our
everywhere.
search engine will get us to that if we go to,
Yes.
if we forget all of that, and we can call Spectrum Generations. They'll help us out as well. But
Absolutely.
please continue.
And I Googled Choosing Wisely, and it was the first thing that
You
showed up.
Google Choosing Wisely, and there you are.
So you come in and you say, I've read this thing about low back pain. It sounds like I don't need imaging. What do you think? So we just skipped the 5 minutes of you coming and saying...
Because I had prepared
because
myself.
you read
I
ahead
did
of
my
time.
part.
Yep. And I know that the recommendations from the specialists say, don't just get an MRI because you got back pain. Let's watch carefully about the symptoms you have and the explanation, the history you give me and my examination.
Right.
Unless I see something really alarming, 6 to 12 weeks before we even think about imaging, and probably at least a month or longer before you get better. So now you have a realistic expectation. You got national experts telling us this is a wise way to go. We're not going to do any imaging.
Okay, and so first of all, you're treating the patient in a more sensible way, and you're also helping to reduce the cost of health care. Unnecessary tests have to contribute enormously to that.
Due to the cost, but honestly...
But that's not your reason. Yours is a medical provider reason.
If it's me, as a provider, I want what's really the best to make you better.
But that's not always the most expensive, is what you're saying.
We talk about value, which is getting your money's worth, and it's not necessarily an expensive test. But from your point of view,
right.
In this day and age, you're not so keen on people saving money if you're not getting the very best health care. But if you read something like this, you realize, I'm going to get the best health care by not getting this test. Well, it saves somebody money. That's great. But it really is to your advantage because there's risks to a test that you don't need. Why would you do that?
Excellent point.
Right.
And I'm sure that's part of what you do with your, talk about consumer outreach a little bit. How do you help educate? You're doing a lot today. This is part of your outreach.
Excellent, and thank you for having us. And it's not all based on the physician or the physician's office. We're also reaching out and working with our area agencies on aging.
Okay.
All across the state. They're a wonderful partner of ours to help their members.
So one could go to area agencies on aging for additional information. If they don't have a computer at home, they could probably get help with any of this information.
They can talk to the staff there, and they'll be very familiar
with
they're
trained as well.
They are, and we're also working with Maine Health Management Coalition so that we can
now
work
they are interested in cost, so it does all go together.
Oh, yes.
That's right.
Yep.
That's right.
I mean, that's for our own well-being in the future too.
Absolutely.
So we don't want to use up all the resources on tests that don't make us better.
Right, and it's helping educate the human resources and working with employees to understand there are risks with certain tests and procedures that take place, but also educating them so that they can learn more about what are my options, what other things can I talk about when I go into my primary care physician's office or my specialty physician office. I want to ask these questions, and it's
Right.
going to, choosing wisely lets you know that it's okay.
That's great.
We're really trying to work with all partners. Also, the primary care offices have what we call patient-family leadership groups. These are
What does that
patients.
mean?
Those are patients who are served by that practice who want to help make a difference for other patients in the practice, to make it a more patient-centered practice, and they talk about things like choosing wisely. And they have a work group at Winthrop Family Medicine to talk about choosing wisely. How can we help educate our patients better? And they are talking about what do they need to have in the waiting room, what can we send out ahead of time.
Well, that must be invaluable to you to have that patient leadership group. How do they interact with other patients? Is there an opportunity? Do they have meetings ever that someone could join? Or
They have meetings monthly that are open, but
that's not their real purpose, is to help make sure they're educating.
yeah. And they advise us, they make suggestions, they send surveys to staff, they send surveys to patients. They've been instrumental in sort of how we present ourselves to the public. And I know that if I have an issue and I want to think about making it more patient-friendly, I'll go to the council meeting and say, what do you think about this? What do you think about that? And they've really latched onto this because
I like this.
in terms of...
It's very readable, isn't it? It's in language that a layperson can understand.
Yeah.
It's not a doctor writing in a journal, a
Right.
medical journal.
No.
Thank goodness.
And in terms of outreach, they help us with structuring and designing how we present information in our waiting room, and how we present information to patients, and this really integrates with that.
Right.
Excellent.
You spoke earlier about how things change, and sometimes the people doing the research disagree. And interestingly, a report came out not so long ago about the use of statins for heart disease. And you're looking at that, probably taking statins, most people do. And talk to us about how you react for new information and educating your patients.
The sum and substance of that news article was about 1 million people who are taking statins, or 30 million people don't need to anymore, but another 30 million who aren't due. So you're sitting
what do
at
you do
home,
with that?
Which 30 million am I a part of? I remember years back when we were convincing all women of a certain age that they should take estrogen supplements.
Yes.
Then a study came out and said, well, no, that's actually bad, don't do that
Exactly.
anymore. And things like that are really hard
It's
to
confusing
explain.
to your patients too, and it's almost comforting to know that you struggle with it as well, because you're thinking about it.
You're trying to.
And making the most of it, and based on your own experience and your own training, I suppose you ask questions that are even more pointed than the question that I might be able to ask.
One of the key intangibles in our relationship with our patients is the trust. And when we build a sort of patient-centered medical home where they feel like everybody there has their best interests at heart, you develop a trust, and you can't really measure that. But people who go to emergency rooms or go to clinics because they need something right now get good medical care, but they don't have the opportunity to build that up. So when you come in and I say, remember I told you to do this last year? This year I'm going to tell you not to do it.
What? You get that look.
If you really
but
know
if
and
they trust
understand.
you, that you've evolved, and I think that's another healthy thing to learn in choosing wisely, that things don't stay the same. Hopefully people don't stop learning, including the medical profession, and that's the message there, isn't it?
It is, and that's why it's always important to ask those 5 basic questions.
Repeat them one more time so
Do I
we'll know
really
to ask them
need-
when we see you.
Yes,
Be
do I
ready.
really need
Your
this
practice
test?
is going to be inundated with very educated consumers. 5 questions.
Do I really need this test or procedure? What are the risks? Are there simpler, safer options? What happens if I don't do anything? And how much does it cost? Could be a question you'd like to
Those are
add.
absolutely fascinating things to do. And do most of your patients do that yet, or you see it's a growing thing?
No, we're as part of the pilot, our goal will be to give this list of questions to every patient that checks into the practice.
So while they're in the waiting room,
they
and
can look at
hopefully they
that.
don't wait too
And
long in your waiting room. Long enough to read the paper.
Couple minutes. But when you give this list to providers, I was expecting to say, I don't have time now, and you want people to come and ask questions. But really, the general response is, that's great. We're going to have the kind of conversation we want to be having, with the exception of question number 5.
Right.
Question number 5 is a challenge.
The cost question is complicated because of the intricacies of insurance and various things.
It is.
But nevertheless, you deal with those risk questions, and that moves that conversation where you want it to be. Oh, I hate to stop right now because you're ready to say something. Please stay tuned. We have a brief segment to tell you even more important things. We'll be right back with more of Mature Lifestyles.
Spectrum Generations. Live healthy, live well. Get answers. Get connected. Spectrum Generations, specializing in the art of aging.
This is the new Hollywood. Hollywood Casino, featuring the heart-pounding action of live table games with Vegas-style blackjack, roulette, poker, and more. Now playing at the place where the fun never stops. From the thrill seekers to the blockbuster winners, here you've got the lead role, because there's no place like Hollywood.
Welcome back to Mature Lifestyles. Kellie and John are helping us make wise choices, and one of the things they symbolize to me is they're partnering. They're partnering in the medical world to get better decisions. So I'm going to turn to Kellie and ask her for her most important words of wisdom for us as we try to choose wisely.
Certainly. I think just to leave with all the viewers is that don't be afraid to ask the 5 questions. You'll see these on your screen. You can also Google Choosing Wisely to get the information you need, and also go to your area agency on aging. Spectrum Generations here in Central Maine can help you with everything you need to know about choosing wisely.
So it's important. There's access on the web. There's access person to person if you don't want to use
That's
that.
right.
Spectrum Generations is one of those resources,
Yes.
and you partner with them.
We do.
John.
What I think about in terms of how I want to provide health care is when I'm the patient and I walk in my doctor's office and I'm not afraid, he's a friend of mine, and I'm struck dumb. I don't know what to say, I don't know what to ask, and I walk out saying, geez, I wish I'd said this. You know, common thing like a sinusitis, do I need an antibiotic or not? And I know, because I have medical training, but why don't I ask these questions? I don't know, and I want my patients to ask the questions. So I think my key is take these 5 questions, take them with you, take a friend or a family member with you.
And you don't mind, do you, if that friend comes in with the patient
It's
or
more
family
challenging
member?
sometimes, but it's so much better, because then when you walk
There
out...
are 2 sets of ears hearing what you say.
And I forget what my doctor tells me when and I'm not afraid of him.
Do you think that they should make, in addition to the 5 questions that you have suggested, their own questions,
Make a list.
write them down, because you're right, in the pressure of getting everything out, you forget, don't you? And take notes about what the doctor said, and ask your friend what the doctor said.
And I think I'm being brilliant in explaining everything, and then I find out later that... it's just, it's what we really want. Even sometimes I'll say, we're not going to have time for all that today. Don't be offended. It doesn't mean I'm trying to shut you up. It's better care to do that. It's better care for you to do that.
And do you find that people sometimes, however, if you lay everything out, the sinusitis, the lower back pain, or whether or not to take an antibiotic, and they sit there and say, I don't know what to do.
Right.
What's your role then?
I try to distill what I just said into, if you do this, this is what you'll get, and if you do that, that's what you'll get. Here's the benefits, here's the risks. And then sometimes I can say, and knowing you, this is probably what you'll want to do.
So you don't mind a gentle nudge if they at least have the information. And you also find it a great benefit, the information that is being shared. And we showed a few of these sheets earlier. And I'm going to have to say, please go to the website. Please visit these wonderful organizations that are helping you to choose wisely. And thank you for joining us on Mature Lifestyle. Spectrum Generation is very grateful.
Mature Lifestyle is made possible by Hollywood Casino. There's no place like Hollywood. And by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
You're watching TWC TV, only on Time Warner Cable.